Hello, welcome to Your Nurse Advocate, Conversations with Your Nurse Advocates. And Linda and I are here with you today. And the topic that we are going to talk about today is going to be telehealth. And so this has become really popular with the upcoming, or with the pandemic, so to speak. So this has been a topic that's been really popular. We have used telehealth actually for many years, and it was something that Medicare provided service for people that lived in very rural areas. But now, since the pandemic, it's really caught on, and it has been a way of doing healthcare now when people were not able to get in to see the doctor. So first of all, what is telehealth? Telehealth, telemedicine, virtual doctor visits. It's all, can be called different things, but basically it's all the same. It's when you either get on a telephone or some kind of computer, tablet, or smartphone where you can do a video chat where you actually are looking and talking with your doctor or provider, and they can see you on both ends. So that's what telehealth is. And so what we're going to talk a little bit about the pros and the cons. So what might be the pros of telehealth? Well, some of the pros of telehealth would be it cuts out transportation issues. Some seniors have trouble with transportation, have to rely on, cabs or medical types of transportation to get to their doctor. Maybe they don't have anyone living near them or, that can take them. So this is something that could reduce some transportation issues. You don't have to leave home if you're not feeling good to go see your doctor. You don't have to go anywhere. And I know, Linda's mom wasn't real crazy about wanting to get out to go see the doctor, but, and so we've talked a lot, and we'll have Linda share in just a minute here. Rule, this is huge. So in my situation, just having some recent surgery, the hospital is 35 minutes away. Now, would it be a good televisit for me to be able to lift my foot up on a camera and have my doctor, see how it's doing? No, I mean, I have to go into the doctor because he has to remove the stitches and wants to do x-rays. So telehealth or virtual visits are not for every type of healthcare situation. But if it was just to see how my pain is doing, or, if I had, some questions about my surgery, a telehealth visit would be great for me. I wouldn't have to drive 35 minutes to the clinic and the next city to a big.
Yeah, so basically you're able to see the physician through your phone and be able to work through some of those components, without leaving the comfort of your own home. But as Pam said, certain types of visits you have to be in person to meet, the components of that visit, such as blood draws. If they need to draw your blood, they're not going to be able to do it through telehealth. They're not going to be able to remove the sutures through telehealth or take x-rays. But for people who are not feeling good, or people who feel that they need to just talk to their doctor because something's not right, a telehealth visit actually could be very productive for them and provide them with a lot of insight and support and comfort.
I think, to give another example that would be a very appropriate telehealth visit, for example, say you're a diabetic, your aging parent or your spouse or a senior, or, you're a diabetic. And so maybe you've had a medication change recently. Well, rather than going into your doctor's office, you can review during your telehealth visit your recordings of your blood sugars. Doctor can determine if you need to have another medication change, all without having to go into the doctor's office. So that would be an excellent example of how a telehealth visit would be just as good as going into the doctor's office. So we started to get into some of the cons of telehealth. And I think Linda, mentioned a couple. I think one of the biggest barriers to telehealth is the inability of some of our seniors to be able to use the technology that's needed to be able to conduct or participate in a telehealth or virtual visit. I know in some of the areas, and again, every county is different, but every county in the state of the United States has either a senior center, aging for disability, resource center, has some kind of government agency directed towards senior resources. So that's the first place I would start, in your county, because I know in many counties, especially since the pandemic, they have little rooms set up where they have computers and they have things, and they actually have staff that will assist a senior in using that technology. So that's one of the ways that we're trying to overcome the barrier of them being able to use that, is to provide some services. I know, and I've been in contact with some, this is since the pandemic too, this has come up as actually a business where there are people that actually, there's companies out there that actually teach seniors how to use technology and put resources and plans in place for them to be able to utilize it. So there's more and more every day is coming up to be able to address that barrier with the technology issues. One of the other barriers that was talked about a lot, and I guess it was a little bit of a surprise to me, but when you're looking at the provider's end of it for telehealth visits, it was shared that one of the barriers they feel is that they did not have the patient's undivided attention. There was a lot of distractions going on. They were doing something else on the computer. They were clicking here. They weren't paying attention. That they're at home. They're looking here. They're looking there. They felt that they did not give them their undivided attention as well as if they did in a in-person visit in the office. So that's something to think about too. When you do a virtual visit, you want to make sure that you're treating this exactly as you would a regular doctor's office, taking with you questions, making sure that you're paying attention to what the doctor says, repeating back what he says so that you know that you're understanding it. And with this, we also have a checklist that's going to be included to be able to get you prepared and get you ready for your virtual or your telehealth visit. So we encourage you to download that checklist and use that. That will really help you get set up and get ready, including one of the items in the beginning of the checklist is doing a dry run. Maybe a grandchild or a parent or a child of an aging parent can maybe sit with them and go through a dry run and walk through and make sure that they know how to access them, because that is another one of the cons or the challenges, is that sometimes you come up with technology issues during the telehealth visit. So it might be a good idea maybe if someone can be there with them, to help them with that. We talked about, I think the last one that Linda touched on that is real important is obviously not all visits are appropriate to use for a telehealth or virtual visit. I mean, if you're having abdominal pain, chest pain, shortness of breath, if you're, something acute that comes on, I mean, dial 911 and take a ride to the emergency room, because, when they have to provide x-rays, lab services, IVs, where a doctor needs to put his stethoscope on you and has to put his or her hands on you, those are definitely, and obviously not appropriate for telehealth visits. So don't think that is a substitute for emergency care, because it's not. Linda, do you have anything you want to add on any of the cons for telehealth?
Yeah, one of the cons is that I can tell you that a lot of times if individuals are in rehab communities or assisted living communities, a lot of times their doctors will say, well, let's do a telehealth visit, especially during the height of the pandemic. There was a lot of that going on. And a lot of times in these communities, the technology wasn't all there, or they would assume that the patient was able to utilize the technology that the community or the facility provided for them. And that wasn't always the case. So I think the biggest barrier, as you said earlier, is the technology and the ability to actually utilize it to its fullest on both ends, both on the provider end and on the user end, to be able to make sure that they get the full benefit of a telehealth visit. And a telehealth visit does include not just a phone call, but there has to be a visual aspect to that actual telehealth visit for it to be considered a true billable telehealth visit. So making sure that you understand the technology and what's going to be asked of you in that visit is appropriate, and being prepared for it. I can tell you my mom was not prepared for her telehealth visit, and the technology that they provided her she has very hard of hearing, so she wasn't able to hear what the doctor was asking. So there had to be someone in the room to almost translate and interpret what the doctor was asking, because she could not hear them. So making sure that you have all the right tools in place to make sure that the telehealth visit goes as prescribed is also really important.
And one of the last things that, well, it is the last thing that we'll talk about regarding televisits is one of the questions that comes up is, are these televisits or virtual visits covered? And what I took out of the Medicare manual for 2022, again, it's been a while that some of the telehealth visits have been covered in the rural areas, but they do cover in certain situations for mental health, end-stage renal disease, but like that normal diabetic med change would not be covered under Medicare as a virtual visit. So there are some drawbacks there. Now, most of the Medicare Advantage plans are commercial insurance companies. They're a little bit more generous with paying for those type of visits. So it's always good to know whatever your payer source is, whether it's Medicare, whether you have a secondary insurance, whether you have a Medicare Advantage plan, Medicaid, a state, insurance program. It's always good to be aware of what types of things are covered or not, so that you're not surprised by any of that. So as we wrap up the topic of telehealth, is there anything, Linda, you want to say in closing?
No, just be cognizant that telehealth is part of our future, and that a portion of your visits will possibly be looked at or be appointed as telehealth visits. And the technology around telehealth is continually changing and becoming more adaptive to the needs, to make it easier for doctors and clinicians to diagnose and treat via telehealth visits.
All right. Well, this is going to be another episode of Conversations with Your Nurse Advocate. And we also would like to just share with you just our contact information. Again, we do have a checklist for you that goes along with this blog post and this video on how to get prepared for a telehealth visit. And so we would like to thank you for stopping by and spending some time with us. And don't hesitate to subscribe to our channel. And please feel free to leave a comment if you have a question about telehealth, or if you have a question on a topic for a family member, for care, or for resources. Please feel free to drop us a comment, because we'd love to do a video for you that would be able to answer all your questions. So if you don't ask, sometimes we don't know what you need to know. So with that being said, we'd like to say thank you. Thanks for stopping by. We'll see you on the next video. Take care.